Footsteps pounded in rhythm. NATO's finest surgical team crowded around the operating table. On the table, the four-star general barely breathed, blood soaking the white sheets red. After 3 hours of intense surgery, the chief surgeon trembled, his voice breaking. "Time of death!" He dropped the scalpel. The entire team collapsed in defeat. Several nurses began to cry. In the mournful atmosphere, a small female voice rang out, quiet but resolute. "No, don't call it. I still know a way." Everyone froze, turning to look at the unknown nurse. In that moment, no one knew that courage sometimes speaks in whispers. Nora Williams, 25 years old, trainee nurse, petite frame, brown hair tied neatly, clear blue eyes that usually look down, not daring to face the doctors. From a Kansas farming family, she joined the military medical corps, hoping to save soldiers like her brother, who'd sacrificed his life on the battlefield. In the military hospital environment, Nora was constantly dismissed. One doctor sneered, "This is a place for the finest minds, not for starry-eyed trainees." Another snapped, "Just hand over the right instruments. Don't interfere with real medicine." Nora didn't react, only quietly recorded notes in her small journal. Surgical case details, intubation techniques, every rare situation. Once she found a young soldier trembling before surgery. Nora sat down, held his hand. "You're not alone. I'll be here." It calmed him down. A witness, an elderly nurse, whispered, "In Nora's eyes, there's a terrifying discipline. Not like a normal nurse." Act 1 in closing. Nora was seen as a shadow in the hospital, but she silently observed and learned from every moment. The military medical facility at Fort Campbell was one of the most advanced in the NATO alliance. State-of-the-art equipment, renowned surgeons recruited from top hospitals worldwide, protocols refined through decades of combat medicine. Nora had arrived 8 months earlier, straight from nursing school, carrying letters of recommendation and a burning desire to serve. What she'd found was a hierarchy as rigid as military rank itself. Doctors were guns, experienced nurses were priests, and trainee nurses, like Nora, they were barely acknowledged. Dr. Marcus Chen, the chief of surgery, had made his philosophy clear during her orientation. "In this facility, we save lives through excellence and experience. Trainees observe and learn. You do not question, you do not theorize. You follow orders precisely. Is that understood?" "Yes, doctor," Nora had replied. But inside, she'd thought, following orders is important, but so is thinking. Her brother Jake had been a combat medic, killed by an IED in Afghanistan 3 years ago. Before deploying, he told her, "Medicine in war isn't about textbooks. It's about adapting, noticing what's wrong before the machines tell you, trusting your instincts." Nora carried those words like a talisman. While other trainee nurses socialized during breaks, Nora studied. She read surgical journals, watched recorded procedures, memorized anatomy in a way that went beyond rote learning. She understood the why behind every protocol. Her roommate Sarah thought she was obsessive. "You're just a nurse, Nora. Why kill yourself studying like you're going to medical school?" "Because patients deserve my best," Nora had answered simply. "Every single one." In the operating rooms, Nora was invisible. She stood in corners, handed instruments, cleaned blood, changed IV bags. Basic tasks beneath the notice of surgeons focused on more important matters. But she watched everything. The way Chen's hands moved, the techniques different surgeons used, the subtle signs when a patient was deteriorating before monitors showed it. Once, during a routine procedure, she noticed a patient's oxygen saturation dropping slightly. The anesthesiologist was distracted, adjusting medication dosages. "Doctor," Nora had said quietly, "the oxygen levels." Dr. Chen had glared at her. "I can read monitors, Nurse Williams. Focus on your responsibilities." 20 seconds later, the alarm had sounded. The patient's airway was compromised. They'd had to intervene quickly. No one had thanked Nora for noticing first. No one had even acknowledged she'd spoken up. But the patient had lived. And that's what mattered. Nora learned to trust herself quietly, to observe without speaking, to see patterns others missed, to know that being dismissed didn't mean being wrong. She just never imagined she'd need that trust to face down NATO's finest surgical team and challenge them to listen to a trainee nurse with a crazy theory about why a four-star general was dying. But that night was coming, and when it did, Nora would be ready. That night, alarms shook the entire base. General Ethan Cole, four-star general, hit by shrapnel during a special operation, was rushed into emergency surgery. The entire hospital shook with urgency. He was the soul of the Corps. Soldiers crowded the hallways, terrified of losing their commander. NATO's finest surgical team was summoned. Over a dozen top doctors took turns operating. Nora stood only in the corner, handing instruments on command. The atmosphere was suffocating. Blood flooded the operating table. Monitors dropped steadily. Oxygen levels plummeted rapidly. One doctor shouted, "Clamp! More suction! Pressure dropping!" They tried every advanced technique: suturing wounds, fluid replacement, defibrillation, chest compressions. But the heart rate kept plummeting. 3 hours passed. The chief surgeon, known as Golden Hands, removed his gloves, bowed his head. "We've tried everything. There's no hope. Time of death." The operating room sank into dark silence. Several people began crying. In the hallway, soldiers collapsed. As everyone let go, Nora suddenly noticed something abnormal. The general's chest moved slightly, inconsistent with the monitor signals. She whispered, voice trembling but determined, "No, don't call it. I still know a way." Everyone looked up, stunned. A doctor snapped, "Be quiet. You're just a trainee." Nora didn't retreat. "The airway, you missed it." The entire operating room was shocked, but no one dared believe. The crisis had begun at 2100 hours with an explosion at a forward operating base 60 kilometers from the facility. General Cole had been conducting a tactical assessment when an artillery shell had hit the bunker. Shrapnel had torn through his neck and upper chest. The field medics had been amazed he'd survived the helicopter transport. The medevac had radioed ahead. Four-star general, critical trauma, multiple penetrating wounds to neck and thorax. ETA 12 minutes. Doctor. Chen had assembled the best team available. Dr. Sarah Mitchell, trauma specialist from Johns Hopkins. Dr. Rajesh Kumar, cardiothoracic surgeon with 3 combat tours. Dr. Elena Volkov, vascular surgeon who'd trained at Moscow's top military hospital. And 8 others, each a specialist, each among the best in their field. The operating room had been prepared like a cathedral before a ceremony. Every instrument sterilized, every protocol rehearsed, every contingency plan. Nora had been assigned to instrument assistance, the lowest role in the hierarchy. She'd prepared trays, arranged sutures, stood ready to hand over whatever was requested. When General Cole had been wheeled in, unconscious, his uniform cut away, his body a canvas of wounds, the team had moved with practiced precision. Dr. Kai Shin had opened the chest cavity, exposing the damage. A piece of shrapnel had nicked the superior vena cava. Another had punctured the right lung. A third had lodged near the trachea. "Control the bleeding first," Chen had ordered. "Kumar, take the vena cava. Mitchell, address the lung. Volkov, I need you ready for anything vascular." They'd worked like a machine, hands moving in perfect coordination, voices calm and professional. The practiced dance of emergency surgery. But despite their skill, despite their experience, General Cole had continued to deteriorate. His blood pressure had dropped, 80 over 50, 70 over 40, 60 over 30. "We're losing him," Mitchell had called out. "Increase fluids. 2 units O negative, stat." Chen commanded. They'd transfused. No improvement. "Epinephrine, 1 milligram." No response. "He's not perfusing properly. There must be internal bleeding we're not seeing," Kumar had said. They'd explored further, found and repaired additional vessel damage. Still, Cole's vitals decline. "Cardiac function is failing," Volkov had reported. "He's in shock." "We know he's in shock," Chen had snapped, frustration breaking through his usual control. "That's why we're here." More medications, more interventions, more desperate attempts. Nothing worked. Nora had stood in her corner watching everything. Not just the surgery, but the whole picture. The monitors, the patient's body, The subtle signs everyone else was too focused to notice. And she'd seen something that didn't fit. General Cole's chest movements were irregular. They didn't match the ventilator rhythm, as if he was fighting the machine trying to breathe on his own but failing. She glanced at the intubation, the endotracheal tube, inserted to maintain his airway during surgery. It looked properly placed. But Nora had leaned slightly closer, listening, and she'd heard it, a faint whistling sound, air escaping where it shouldn't. Her eyes had widened. After 3 hours, when every technique had failed, when every drug had been administered, when every option had been exhausted, Dr. Chen had stopped. His shoulders had slumped. His hands, steady through 1,000 surgeries, had trembled. "I can't save him," he'd whispered. "I've tried everything I know, everything we know, and it's not enough." He'd looked around the room at his team, brilliant minds, capable hands, all of them defeated. "Time of death," he'd said, his voice hollow. 23:47. No one had moved. The finality of those words hung in the air like lead. Outside, someone would have to tell the soldiers. Tell them that their general, their leader, the man who'd led them through 3 campaigns, was gone. Dr. Mitchell had removed her surgical mask, tears streaming down her face. Dr. Kumar had bowed his head in a silent prayer. Dr. Volkov had simply stared at the body, unable to process the failure. And Nora, in her corner, invisible as always, had looked at General Cole's chest still moving irregularly and thought, "He's not dead. They just don't see it." She'd taken a breath, knowing what she was about to do would either save a life or end her career. Then she'd spoken. "No, don't call it. I still know a way." The chief surgeon hesitated, then growled, "You have 30 seconds. Do it." Nora took a deep breath, examining the endotracheal tube. She realized it was misplaced because the larynx was partially fractured. Instead of delivering oxygen to the lungs, it was completely blocking the airway. She shook her head. "He's not dying from blood loss, but from suffocation. Oxygen isn't reaching his lungs." Everyone fell silent. An older doctor protested, "We checked the tube multiple times." Nora replied, "Wrong angle. Just listen to the whistling sound at his neck. Anyone can tell." She quickly performed an emergency cricothyrotomy. A whoosh sounded as air rushed in. The general's chest expanded. The monitor lit up. Beep, beep, beep. Heart rate restored. The entire operating room fell silent, then erupted in astonishment. One doctor exclaimed, "My God, we missed the most basic thing." First twist, a trainee nurse saved a life with a simple procedure when the world's top surgical team had failed. Second twist, the chief surgeon, who declared death, bowed his head and choked up. She was right. The nurse saved him. General Cole opened his eyes, his voice hoarse from the neck injury, whispering, "Who saved me?" The chief surgeon answered, "Not the finest team. It was the nurse, by me." News spread to the hallway. Soldiers erupted. "He's alive! The nurse saved him!" The doctors who'd dismissed Nora looked at her with shame, bowing their heads silently. The 30 seconds felt like 30 minutes. Dr. Chen had given permission more from exhaustion than belief. What did it matter? The general was dead. If a trainee nurse wanted to try something futile, at least it would delay the terrible finality. But Nora moved with a confidence that shocked everyone. She'd approached the operating table, ignoring the incredulous stares. Her eyes had gone immediately to the general's neck, to the endotracheal tube insertion point. "The tube placement looks correct on imaging," Dr. Mitchell had said defensively. "We confirmed it twice." "Imaging doesn't show partial tracheal collapse," Nora had replied, her voice steady now. "The shrapnel that lodged near the trachea caused structural damage. When you intubated, the tube pushed into the damaged area, creating a complete obstruction instead of an open airway." Dr. Kumar had stepped closer. That's possible, but we should be hearing straight or audible breathing difficulty." "You can hear it," Nora had said. "You're just not listening." She'd leaned down, her ear near the general's neck. The faint whistling sound was there, air escaping from the damaged trachea into surrounding tissue. "Surgical emphysema," she'd said. "Air in the subcutaneous tissue." Feel his neck. Dr. Volkov had reached out, palpated the neck area, and her eyes had widened. Crepitus. She's right. There's air in the tissue. Which means the airway isn't patent, Nora had continued. The tube is blocking, not opening. He's suffocating while we try to save him from bleeding. The room had suddenly understood. All their interventions had been correct for the wrong problem. They'd been treating hemorrhagic shock when the real issue was hypoxic shock. No oxygen reaching the brain, no oxygen reaching the heart, no oxygen reaching any organ. That's why nothing had worked. We need to remove the tube and perform a cricothyrotomy, Nora had said. Create a direct airway below the obstruction. Dr. Chen had stared at her. A trainee nurse was dictating surgical procedure to him. And she was absolutely right. Do it, he'd said. Everyone assist her. Now. Nora had picked up the scalpel with steady hands. Months of observation, of studying, of learning procedures she wasn't supposed to need, all came together in this moment. She'd identified the cricothyroid membrane, the space between the thyroid and cricoid cartilage. It was emergency airway access used when standard intubation failed. One quick incision, a rush of air as pressure released. Insertion of a tracheostomy tube directly into the airway below the damaged area. The whistling sound had stopped. For 2 seconds, nothing happened. Then General Cole's chest had expanded properly for the first time in 3 hours. Real breaths, deep breaths. The monitor, which had been showing a dying heartbeat, had suddenly displayed a strong, regular rhythm. Beep, beep, beep. Blood pressure had started climbing. 40/20, 50/30, 60/40. Color had returned to the general's face. His fingers, which had been turning the blue, flushed pink. Dr. Mitchell had gasped. It's working. It's actually working. Saturation improving, Dr. Kumar had called out, watching the monitor. 70%, 80, 90. He's oxygenating. Dr. Volkov had checked cardiac output. Heart function normalizing. He's perfusing again. Within 60 seconds of Nora's intervention, General Ethan Cole had gone from dead to stable. The operating room had erupted in chaos. Not the chaos of emergency, but of disbelief. How did we miss this? Someone had asked. We were so focused on the obvious injuries, Dr. Chen had said quietly, that we missed the subtle one. The airway compromise wasn't visible on imaging because it was positional, created by our own intervention. He'd looked at Nora, really looked at her, for what felt like the first time. You saved his life, he'd said. We declared him dead, and you saved him. I just noticed what you were too busy to see, Nora had replied. No, Dr. Chen's voice had been firm. You did more than notice. You had the courage to speak up when every person in this room told you to be quiet. You challenged authority to save a patient. That's not observation. That's heroism. General Cole's eyes had fluttered open. The sedation was wearing off. He'd looked around, confused, trying to speak, but unable because of the tracheostomy. Dr. Mitchell had leaned close. Don't try to talk, General. You were severely injured. You're in surgery. You're going to be okay. Cole had mouthed a word. How? A nurse, Mitchell had said, her voice breaking. A trainee nurse saw what we couldn't. She refused to let you die. Cole's eyes had found Nora, and in them she'd seen something she'd never seen directed at her before in this hospital. Respect. Outside the operating room, news had spread instantly. Soldiers who'd been grieving, preparing to lose their commander, had suddenly heard, he's alive. The general is alive. The hallway had erupted in cheers. Grown men had wept with relief. Some had fallen to their knees in prayer. A young lieutenant had asked, who saved him? Which doctor? A surgical assistant, still in shock, had replied, not a doctor, a nurse. Nora Williams. She's just a trainee. The lieutenant had looked confused. A trainee saved a 4-star general when the best surgeons failed? That's exactly what happened. And word had spread like wildfire through the base, through the military network, through the world. Inside the operating room, Dr. Chen had removed his surgical mask and addressed his team. We failed tonight, all of us. We're supposed to be the best, and we failed. He'd turned to Nora. Except her, she didn't fail, because she did what we forgot to do. She looked at the whole patient, not just the injuries we expected to see. She listened when we were too busy talking. She trusted her observations when we trusted our assumptions. He'd extended his hand. "Thank you, Nurse Williams. You taught us all a lesson tonight." Nora had shaken his hand, tears finally falling. "I just did what my brother taught me," she'd whispered. "Notice everything, trust nothing, and never give up on a patient." "Your brother would be proud," Dr. Chen had said. "So am I." The next day, the entire base spread the news. A nurse saved the four-star general's life when the finest surgical team was helpless. Doctors who'd mocked Nora publicly apologized. "We owe you an apology in his life." The general, after recovering, wrote a handwritten letter. "When everyone gave up, a nurse still saw my breath. She still knew a way." International media reported, "Young nurse discovers airway error, saves general when top doctors fail." The image of Nora, her surgical gown blood-stained, eyes shining bright, went viral with millions of shares. Medical schools added to their curriculum. Medicine isn't just knowledge and credentials, but eyes and heart. The transformation began immediately, but deepened over days and weeks. Within hours, Nora's story had reached military medical command. Within a day, it was featured in medical journals. Within a week, it was being discussed at hospitals worldwide. Dr. Chen wrote the case report himself, "Missed airway obstruction and complex trauma, a case study in diagnostic fixation and the value of fresh perspective." But everyone knew the real title was, "Listen to Your Nurses." The article was published in the Journal of Trauma Surgery and became the most downloaded paper in the journal's history. Medical conferences invited Nora to speak. The first invitation came from Johns Hopkins, ironically where Dr. Mitchell had trained. Nora had wanted to decline. "I'm not a speaker. I'm a nurse, But General Cole, recovered enough to walk with assistance, had visited her personally. "You saved my life," he'd said. "Now save others by teaching what you know." Not everyone will face a moment like ours, but they need to understand what that moment teaches. So Nora had gone, standing before hundreds of doctors, nurses, and medical students, terrified but determined. She'd told her story. Not as a hero tale, but as a lesson in humility, observation, and courage. The standing ovation had lasted 4 minutes. But the real changes happened in small moments, in operating rooms and emergency departments around the world. A nurse in Germany spoke up about a patient's declining condition, and the doctor listened instead of dismissing her. A trainee in Japan noticed an irregular heartbeat the monitors missed, and the team investigated. A medic in Afghanistan trusted his instinct about a soldier's injury, and that soldier lived. Each time, someone cited Nora Williams as their inspiration. Medical schools redesigned curricula. They added training modules on interprofessional collaboration, teaching doctors to actively seek input from nurses and other staff. They implemented Code Nora policies, where any medical professional could call a formal pause during procedures to raise concerns without fear of retribution. They studied the Williams effect, the phenomenon where hierarchical structures in medicine cause experts to miss obvious diagnoses because junior staff were afraid to speak up. At Fort Campbell, the culture transformed. Trainee nurses were invited to case discussions. Their observations were formally recorded. Their concerns were treated seriously. Dr. Chen himself led the change. In his first department meeting after the incident, he'd said, "We are excellent surgeons, but excellence means nothing if we're too arrogant to learn from anyone who can teach us. And anyone can teach us." That's the lesson. Nora found herself promoted, given responsibilities beyond her experience level, invited to observe complex procedures and offer input. She tried to decline. "I'm not ready for this." "You saved a 4-star general," Dr. Mitchell had said. "You're ready for anything." But Nora's greatest impact came in quiet moments. A young soldier before surgery, terrified, would ask, "Are you the nurse who saved the general?" "I'm a nurse who tries to help," Nora would reply, holding his hand, "and I'll be here with you. You're not alone." That soldier would go into surgery calm, trusting, knowing that someone was watching over him who truly cared. 6 months after the incident, General Cole returned to active duty. His first action was establishing the Nora Williams Award for Excellence in Military Nursing. a full scholarship program for nurses who demonstrated exceptional clinical judgment and courage. She gave me life, Cole said at the announcement ceremony. I'm giving others the chance to follow her example. Nora, standing beside him, had simply said, I hope they do it better than I did. Impossible, Cole had replied, because you were perfect. If you believe true strength isn't about titles, type, I will live with kindness. Nora declined all interviews, simply returned to work, cleaning operating rooms, organizing instruments as if no miracle had occurred. People only remembered the moment she whispered, I still know a way. A veteran doctor wrote, the greatest revenge isn't shouting at those who dismiss you, but letting them witness truth through your own hands. The symbolic closure, the small cricothyrotomy tube from that day was placed in a glass case in the hospital, with the inscription, when breath returned, hope returned. The lesson, true strength lies not in degrees or rank, but in the courage to trust the details you see, even when everyone else has given up. 5 years later, Nora Williams was 30 years old, a senior surgical nurse at Fort Campbell, with credentials and experience that commanded respect. She'd been offered positions at prestigious civilian hospitals, teaching roles at nursing schools, even a position in military medical administration. She'd declined them all. Why stay? Her old roommate Sarah had asked. You could work anywhere. Because here, I can make the biggest difference, Nora had answered. Soldiers need nurses who understand combat trauma, who won't give up on them, who remember that sometimes the simplest answer is the right one. She'd become a mentor to trainee nurses, teaching them not just procedures, but philosophy. Medicine has incredible technology, she'd tell each new class. Monitors that track every vital sign, imaging that sees inside the body, medications that perform miracles. But none of that replaces careful observation. Your eyes, your ears, your hands, your instinct. Those are your most important tools. General Cole had fully recovered and risen to chairman of the Joint Chiefs of Staff. Before his appointment, he'd visited Fort Campbell one final time to see Nora. I'm retiring from Field Command, he'd told her, moving to the Pentagon, but I wanted to thank you one more time. I've had 5 years I wasn't supposed to have. Watched my daughter get married, met my grandchildren, had conversations and experiences I'd missed if you hadn't spoken up. I'm just glad you're well, sir, Nora had said. I'm more than well. I'm grateful, and I want you to know something. He'd pulled an envelope from his jacket. I've written this letter to be opened after I die. It tells the story of that night, every detail, and it ends with 7 words. She still knew a way to hope. Nora had felt tears forming. That's beautiful, sir. It's true, you gave me hope when there was none. And I want future generations to know that sometimes the quietest voice carries the most important message. The cricothyrotomy tube remained in its glass case. Beside it, they'd added Dr. Chen's case report, General Cole's handwritten letter, and a photograph of Nora from that night, exhausted and bloodstained, but with eyes that shone with determination. Thousands of medical students and professionals visited that display each year. They'd read the materials, study the timeline, understand how close General Cole had come to death. And they'd learn that courage isn't about rank or credentials. It's about trusting yourself when everything and everyone tells you you're wrong. One young nurse, fresh from training, stood at that display for a long time. She turned to Nora, who happened to be walking past. Is it really true? You challenged all those doctors? Yes, Nora said simply. How did you know you were right? Nora thought carefully. I didn't know for certain, but I knew what I saw, and I knew that staying silent meant watching someone die. So I chose to speak, even if it meant being wrong. What if they'd been right and you'd been wrong? Then I'd have learned something, but he still would have died. At least this way, we tried everything, including listening to the person nobody expected to have the answer. And the young nurse nodded, understanding. Nora continued her rounds down familiar corridors, past operating rooms where she'd spent thousands of hours, toward the ICU where patients needed her care. She was 30 years old, not famous despite everything, not wealthy, not powerful by traditional measures, but she was exactly who she'd set out to be, a nurse who never gave up on patients, who trusted her observations even when challenged, who remembered that medicine isn't about ego or hierarchy, it's about seeing clearly and acting courageously. Dr. Chen, now retired and teaching at medical school, had written in his final academic paper, "In 40 years of surgery, I've learned this. Wisdom comes not from experience alone, but from the humility to recognize truth regardless of its source. A trainee nurse taught me that. She was 25 years old and had been a military nurse for 8 months. But she was the wisest person in that operating room. That paper became required reading at medical schools worldwide because its lesson was fundamental. Medicine isn't a hierarchy. It's a collaboration. And sometimes the most important voice belongs to the person everyone underestimates. Nora's legacy lived not in monuments or awards, but in changed protocols, saved lives, and empowered voices. Every time a nurse spoke up and a doctor listened. Every time someone trusted their observations despite lacking credentials. Every time courage defeated hierarchy. That was Nora's legacy, and it would echo through every operating room, every emergency department, every moment when someone whispered, "I still know a way." If you believe in stories that touch the heart like this one, leave a comment, and don't forget to subscribe to SN Touching Stories. We tell the stories that shouldn't be forgotten.